Hello viewers, hello from Kolkata. Today's video is going to be really interesting. I hope you will like it. Stay tuned. I have uploaded more than 100 videos on YouTube so far, but if you're new to this channel, hello, I am Puspen Gupta. I am an Indian ENT specialist and I try to upload new videos on YouTube at 9 p.m. Indian Standard Time every day of the week. Today's video, that is Sunday videos, usually talk about transitioning to the United Kingdom, and I make these videos because as I record this video, I hold registration to practice medicine in both India as well as in the United Kingdom of Britain and Northern Ireland. So without further ado, let's get into justifying the title of this video, that is Akla Cholore, which is basically Bengali for walk alone. Have you ever asked the question, how do surgeons learn to perform surgery? I'm sure there are YouTube videos that explain this in fun three-dimensional animation ways, because if you don't use animation, then it becomes sensitive content. I'll tell you how surgeons might learn how to perform surgeries. There are artificial intelligence generated scenarios which mimic human anatomy, human disease, everything exactly how it is inside the human body. And postgraduate students or people training to become surgeons spend hours, days, weeks in these labs where when they perform these simulated scenarios, when they are in these simulated scenarios and they perform surgeries in these simulated scenarios, they with time develop the required skills to perform surgeries perfectly, so that the first time they perform surgeries independently, they are always perfect. You can choose to believe this. If you believe that explanation, the next time you visit a medical college, don't communicate with medical students. Of course, if you are a patient, and if I am a patient, to be really honest, I don't want to communicate with medical students. I want to communicate with doctors. But if I find myself as a patient in a medical college, I will encounter medical students and I will not want to talk to them, because I know that medical students learn with the benefit of artificial intelligence, with the benefit of simulated scenarios. In some medical colleges, simulated scenarios have still not become mainstream, and in those colleges, patients might encounter these medical students. How to deal with this? Medical students should introduce themselves as medical students, and then the patient would, in all likelihood, not have unrealistic expectations from them. Their response might be, I don't want to talk to you, which is fair. You have to respect the wishes of the patient. Or they can interact with you with a mild annoyance, but you have to interact with patients as medical students only if they give permission. Of course, only in scenarios which are not emergencies, because in those situations, of course, every minute counts. With that out of the way, let's talk about a communication I overheard between a government college medical student and a private college medical student. As I explained a little bit earlier, patients consider the term medical student as unwelcome when they visit a medical college. So there is, for lack of a better word, stigma associated with the term medical student. But then there is stigma and there is stigma. There is stigma associated with medical student. Imagine the stigma associated with the phrase private medical college student. There shouldn't be. And I say this with complete confidence because I have had the opportunity of teaching private medical college students, and I have seen how aware they are about this stigma. Do we really want to be in a country where students carry around this stigma around their psyche? They are growing up with acutely aware of the stigma, and we as a society should not stigmatize them, because at the end of the day, there is a governing body which decides standard practice for doctors, irrespective of whether they've obtained their degree from a government medical college or a private medical college. And doctors are subject to evaluation all the time. The best evaluation is often by the patient they treat. If patients are recovering, it doesn't really matter, does it, whether the degree was obtained in a government medical college or in a private medical college. Food for thought, isn't it? Now let's talk about a communication I overheard between a government medical college student and a private medical college student. This government medical college student said, and I don't want to demean anyone, but it's just something I heard. Oh, that surgery is something which first year trainees perform here. Of course, in simulated scenarios, not on real patients. And I'm sure the private medical college student did not like hearing that. This is not the right attitude. It's okay if you perform more surgeries in simulated scenarios, but bragging about it, not cool. Anyway, so with that out of the way, let's justify the much ignored title of this video. At the end of a long course, and as doctors, we are familiar with long courses, we have to ask ourselves, what do we want? What do we want from our careers? What kind of a doctor do we want to be? And sometimes these answers can only be arrived at when you think about it yourself. It's your path, you have to walk it, and usually you have to walk it alone. Akla chalo re. Take care, bye bye, and please don't ever forget to be awesome.